This patient came in pain on teeth 3 and 5, and both of those were ready to get a bridge abutment. When we look at tooth number 5, notice the anatomy. So we decided to do a limited field of view 3D CBCT, and when we took the image, we noticed that tooth number 5 actually had 3 roots, almost like a mini molar. And they are very calcified, especially the mesiobuccal and distal buccal. So in this case, we decided to use ZenFlex CM files by Kerr. And when we use these files, the cool thing is that they come already having glide path files in them. Yes, this assorted pack is really cool. They already have 3 glide path files in them, size 13, size 15, and 17. We look really close here, going from left to right. That's the 13, that's the 15, and 17. And I like to use those first. And once I get my working length established with a size 10 hand file, I like to go in with the 13, 15, and 17. Once I actually get my working length, the glide path files, and then I use the files that are already present, which is a size 30, 25, and 20 all the way down. So you see I'm pointing at the glide path files once again, and these are the regular files that are 30, 25, 20, and I like to use crown down in that fashion. So when you use these files are super duper flexible, so they very rarely ever separate. In fact, I haven't separated not one yet, and I've probably been using this since it came out a couple of years ago. And you can see the flexibility here. The cool thing is if they are getting ready to separate, what happens is it will flatten out in the area, so you'll know to change it out. So in a case like this, you really want to watch it when we have very tight calcified canals, especially with this 3-rooted premolar, with the mesiobuccal and distal buccal canals are very tight. But I am very confident in this file. I've used it on, I don't know, hundreds or maybe even 1,000 cases by now. I like to use the cordless handpiece elements by Kerr and the ZenSeal. And this is the case here as completion. Teeth number 3 and 5, everything's finished really well. And notice that on tooth number 5, this is an 04 taper. We finished at about a 20-25 04 taper. You don't want anything bigger than that because you can strip per the case. I talk more about this in my textbook and my lectures.